Okay. Well, we're going to start. Good morning, good afternoon, or good evening, everyone, wherever you are. Hope you, your families, and colleagues are very well at this time. Thanks for attending our panel, domestic violence against women. Domestic violence during COVID times. The against women is another panel. Our panel today is domestic violence during COVID times. Here at the United Nations World Data Forum 2021. My name is Adrian Franco. I'm Vice President of the National Institute for Statistics and Geography, INEGI, in Mexico, and I have the honor to moderate this session. A few words before starting, because we all know that our lives were changed by the COVID-19 pandemic itself, but also because of the policies, actions, and decisions that were made in order to reduce the impact of this virus in societies. Of course, the COVID-19 pandemic has been changing many dimensions of our lives. Some changes for good and some changes for bad. Changes, for example, in criminal trends and antisocial behaviors are specific examples of very bad changes. This is also the case for domestic violence. It is very common today to open newspapers, social networks, statistical reports, news on TV, and other information media to find that domestic violence has increased during COVID-19 pandemic, specifically as a result of the different or several lockdowns. Domestic violence, historically and during COVID times, has been one of the most serious health and violence-related concerns. It is also important to recognize that domestic violence is not just a personal or private problem, but it is also a social problem. Um, to understand how this type of violence crosses physical, economical, social, and in any other phenomena, borders has required, and it requires efforts from the international community. Related to this issue, UNODC has revealed through different reports that households are one of the most dangerous places for women, with majority of female homicide victims worldwide killed by partners or family, as it is reflected in the publication What Crime and Helpline Data say about the impact of the COVID-19 pandemic on reported violence against women and girls. It is important to highlight the works on prevention done by the Ending Violence Against Women section at the UN Women, and the briefs done by this section at UN Women, which explores in depth the trends and impact of the recent global COVID-19 pandemic on violence against women and girls. And I would also like to stress the work developed by the OECD, such the Working Party on Gender Mainstream and Governance. OECD has also created an international legal standard to end physical abuse and sexual exploitation in the aid and humanitarian sectors, as well as the interesting OECD's podcast on preventing violence against women, like the unknown brain injuries of domestic violence survivors or the sheltering from domestic violence. For analyzing this topic, we have a very great panel today with three experts: Tatiana Teplova, Calliope Mingeru, and Enrico Bisogno. In our session, speakers will exhibit several experiences in producing and using different statistical information related to domestic violence during COVID-19 in order to provide comprehensive and reliable information to domestic to dimension some such phenomenon. So let's start with our first speaker. She is Tatiana Teplova. Tatiana has worked at the OECD since 2010, where she is currently head of the division and senior counselor in the Policy Coherence for Sustainable Development Goals division in the Public Governance Directorate. She also leads the OECD work on equal access to justice and gender equality in public life by developing international standards and advising governments on people-centered justice, access to legal and justice, services, and gender-sensitive policymaking. Mrs. Teplova holds a doctorate degree in public policy from Carleton University. The title of the presentation of Tatiana is Eliminating Gender-Based Violence and OECD Contribution. Tatiana, thank you very much for being here. Welcome, and the floor is yours.
Thank you, Adrian. And I'd like to thank, of course, INEGI-México for the invitation and to greet all participants who have joined this session. I don't need to remind us, and I think that Adrian in his introduction has already highlighted many of the issues that gender-based violence indeed represents a global crisis. Some of the data that we see is that worldwide, 1 out of 3 women have experienced some form of GBV, gender-based violence, at least once in their lives. We also know that the COVID-19 pandemic, among, of course, its many other impacts and effects, has exacerbated this crisis. And in fact, I'm really pleased that my partner, the colleagues from our partner organizations are here because, of course, yes, the UN Women adopt this phenomena as the shadow pandemic, also which happened during the crisis. If we go to the next slide, please. And as mentioned, many international organizations have done excellent and important work on addressing GBV, and the OECD is a relative latecomer to this area. And in fact, it is actually the OECD member countries that have identified this area as a priority, as actually the highest priority issue to be addressed, which actually was the case both before the pandemic and during the pandemic. And of course, this became the priority for the OECD as well. For instance, even in 2016, 21 out of 37 countries that the OECD has done the survey of identified GBV among the top 3 most urgent gender equality issues for their countries. And also in 2020, in the midst of pandemic, actually 92% of respondents highlighted this as the most critical issue to try to manage during the COVID-19 crisis. For the next slide, I just would like to highlight that, of course, from the OECD perspective, we are committed to support our members and also partner countries to eliminate GBV. Adrian already mentioned our working party on gender mainstreaming and governance, which brings together representatives of gender equality institutions from the member states. The working party has established a technical advisory group on this issue, and also there is regular policy dialogue on the good practices, but also lessons learned and looking at the experiences that were not so successful in eliminating GBV. In parallel, we are looking at this issue as part of the OECD work on access to justice roundtables and specifically tackling the topic of creating survivor-centric pathways to accessing justice. So how to develop legal and justice, but also related services that really center on the needs of survivors in a holistic manner. In this context, and also complementing the work of our partner institutions, the OECD has released a policy framework on strengthening governance and survivor-centered approaches to eliminating GBV, which also reflects the lessons learned and good practices from our members. So I anticipate that we have many of our members in the audience, so this is a big thank you and acknowledgement for your contributions. So as you can see on this figure, the framework presents a 3-pillar approach to create creating what we call a whole of state framework for GBV. Under the first pillar, systems, the focus is again on creating this whole of state system to prevent and to respond to GBV. On the second pillar, the focus is on creating a governance and service culture that is also survivor-centered. So how can we build the culture of institutions that focuses on survivors? And the third pillar on access to justice and accountability also covers the of access to justice for survivors from all backgrounds, but also bringing to justice those who perpetrate GBV. If we, yes, we go to the next slide, but just maybe to mention that the framework emphasizes the importance of collecting robust data along the different stages or different phases of the process for addressing GBV, from prevention to protection to prosecution and integration. And we recognize that many countries are collecting quite a bit of administrative data from different service providers, be that police or hospitals. There are a number of, I would say, actually quite a few additional data sources that we would encourage countries to be utilizing to really address this issue of GBV holistically. I will highlight some of them on the coming slides. So on this slide, we really emphasize the importance of access to justice and to kind of to really facilitate a healing process for survivors. The OECD evidence that we have collected again from many of our members shows that lack of access to justice can influence the social, emotional, and financial outcomes of women, but also, yes, girls, boys, and sometimes men who are survivors of violence, as well as their families. And also we see that women can be experiencing specific barriers to access, including costs, complexity, but also sometimes stigma, sometimes lack of gender sensitivity of the different service providers that they have to deal with. Maybe just to highlight quickly the example from one of our member countries, Australia, the law survey showed that respondents who had experienced gender-based violence were 10 times more likely than others to experience additional legal problems. So they face a legal problem related to GBV, but also on top of that, they are dealing with issues related often to child custody or some other consumer issues, so housing. And also these victims or survivors were 16 times more likely to go through family law issues. So just to say that the cluster of legal needs that GBV survivors face is actually among the highest of all of the potential users of the access to justice system. And here data has a large role to play, also to inform the design of services around responding to GBV needs. Let me briefly highlight two types of data and how they can be used. So first is data to understand the legal needs of GBV survivors. And here, this type of data can be collected through surveys of legal needs that are specifically tailored to, to needs of survivors. And here, these types of surveys can help governments both to strengthen legal capability of GBV survivors, but also prevent GBV and correct systemic injustices, but also inform the design of services to respond to the needs of survivors. Of course, given the sensitivity of collecting data on GBV, this data collection should be voluntary and avoid any further trauma. Of course, also victims' privacy needs to be protected. But this type of data can indeed help inform the services, but also look at ways to reduce reoffending rates. And actually, here the OECD argues that we need to have more data to understand what works in terms of the different range of interventions that are developed by a wide range of stakeholders, from governments, but also different agencies and governments, by NGOs, by the private sector. So we need to have more data to understand what is actually making a difference for the lives of survivors and actually reducing the rates of reoffending. And maybe also the second type of data to mention briefly is data related to cases of femicide. I expect that colleagues from UNODC will talk more about this, but just to emphasize that the OECD framework includes a recommendation to governments to actively track femicides in order to better understand how and also why women face, primarily women, face gender-related risks of death. Next slide, please. And here we just highlight some of the barriers to collecting these types of data. Obviously, these barriers were highlighted by many of our members, but also partner international organizations. And here, just to briefly mention the lack of harmonized legal definitions of forms of GBV, also needing to expand the collection of administrative data to really account for the full variety of different encounters with public authorities that are made by survivors. And also we know that, for instance, forms of violence like sexual harassment or stalking are less covered by administrative agencies. So there is less data available, and we need to continue thinking collectively about how to address this issue. Of course, there is also the issue of underreporting of GBV, needs to strengthen coordination mechanisms between agencies, departments, and service providers. I already talked about privacy, but yes, respecting privacy and confidentiality are really paramount for the protection of survivors. But also, maybe the last point to mention here is the lack of gender disaggregation of data, be that for often victims or perpetrators, but also by types of violence or the relationships between the victims and the perpetrator. Next slide, please. This is the last slide. Just to mention that the OECD stands ready to continue supporting countries and our partners in this regard. We've been developing a wide range of different tools, not only in the Public Governance Directorate, but also given the complexity of GBV, this is an effort that brings together different parts of the OECD. What you see on this slide is just a few tools and additional efforts that are being developed by the OECD in this area. First is the GBV survey. Here we are collecting the data from the countries, so it's not the countries collecting data themselves, but it's actually the OECD collecting data from the countries on the types of instruments that they're using to understand GBV incidents, but then also what works and how to address this issue. We are in the process of preparing our flagship publication on the basis of this information collected from the member states, and we hope that good practices and lessons learned from the countries will be relevant to the global community. Legal Needs Survey Guide. This is an instrument that was developed to provide support to the countries in developing legal needs surveys, but also the ones that to be tailored to the needs of survivors of GBV. The OECD Social Institutions and Gender Index. This is a tool that measures cross-country discrimination against women in social institutions, be that formal and informal laws, social norms and practices that covers 180 countries. But importantly, it also includes data on harmful masculinities that can play a strong role in perpetuating GBV. I already mentioned the framework on governance and survivor-centric pathways. The framework was released for the meeting of the OECD Council at the ministerial level in May, and it includes a series of recommendations to governments, but also good practices on addressing GBV from a whole of state approach. And then maybe two last points to briefly highlight is deepening the work on evaluating what works, working together with our colleagues from the Employment, Labor and Social Affairs Directorate. We are looking at ways to evaluate the effectiveness, for example, of different offender programs, and if they are likely to reduce the rates of reoffending, but also, yes, different access to justice interventions. And we just would like to encourage all of the member countries to also be investing in developing this robust evidence to understand what is working, what is making a difference in the lives of survivors, and also sharing this knowledge globally. And yes, country-specific support. Here the OECD is working with the partners to provide tailored reviews for countries, but also implementation support to improve their responses and services to eliminate GBV. So let me conclude by saying that GBV is a complex phenomena. No country has managed to completely eliminate it. And for this reason, we collectively as a global community, as countries need to double our efforts to address this issue. But of course, in order to do so, we need to be guided by evidence, also evidence of what works, and comprehensive data that can guide our decisions. So thank you so much for your attention, and look forward to the discussion.
Tatiana, thank you very much for a great presentation. Of course, it is very important to know the holistic approach that is in OECD that you are working, not just for monitoring the issues like gender-based violence, but also to creating several tools that are useful for the countries and other organizations in order to understand and to attend this huge problem. Thank you very much, Tatiana. We are going back later with the question and answer section. Thank you very much. Just a minute before introducing our next panelist, I would like to express an apology for the technical problems that we experienced at the beginning of this panel. It happens sometimes, the connection between countries and borders. So sorry about it. You just missed the introduction by the moderator, but the most important is that you are watching the presentation from our expert speakers. So thank you very much for staying here with us, and sorry about it. Now, let's move to our next panelist. I have the honor to introduce Kalliopi Mingerou. Kalliopi Mingerou is currently the chief of the Ending Violence Against Women section at UN Women in New York. Prior to joining UN Women, Mrs. Mengerou worked as a lawyer in Greece, and at international level, she worked for UN agencies and also for NGOs in the areas of human rights, women's human rights, and refugee protection in several countries, both in development and humanitarian settings. The title of the presentation from Mrs. Mengerou is The Shadow Pandemic of Violence Against Women, what we know from the data and how data have informed policy responses during COVID-19. Welcome, Calliope. Thank you very much for being here. The floor is yours.
Thank you so much, Adrian, and thank you very much for the invitation. And I'm delighted to be among very distinguished panelists and colleagues. Thank you very much. So I think Adrian and Tatiana, you have already framed the issue very well. And we call it as a shadow pandemic, violence against women. And I'm afraid it's not that shadow, because we have very alarming rates of violence against women and different forms of violence. Next slide, please. Just to show to you some, next slide, please. Very good. Tatiana referred already that we have the most recent WHO estimates, 1 in 3 women that they have ever experienced physical and sexual violence by partner or non-partner in their lives. And I have to say that these estimates do not really capture an overwhelming form of violence, which is sexual harassment and sexual violence in public spaces. So the problem is even bigger than the data that we can capture. You can see already that we have some other data, and UNODC has reflected that about how homes are the least safe for women. We have rates about trafficking and also online harassment, which has been already exacerbated during COVID-19. So I'm afraid that these alarming rates of violence do not make the violence against women as a shadow pandemic, but it's a very real pandemic in our societies. And just to emphasize, and Tatiana alluded to that, that it's not COVID-19 that created violence against women and girls, that pre-existed, that we had already all the factors and the drivers that they were creating violence against women and girls, and COVID-19 just exacerbated the risk factors. Next slide, please. And this is why in April 2020, UN Women, together with the WHO, we put together a brief guidance in order to see how we can address the huge demand that we were experiencing for data, and to understand also how COVID was impacting violence against women and girls. What we have been guiding member states and others is that conventional face-to-face data collection methods may not be feasible in the context of lockdown and stay-at-home orders. And remote data collection methods may put women at higher even risk of violence. We applied specific principles in this guidance that they should guide the data collection exercise. First, the priorities should always be protecting and supporting women who experience violence. Second, existing data can already provide strong evidence to inform the response to COVID-19. And third, ethical and safety principles for violence against women data collection should remain paramount during a crisis. We also developed, together with WHO and UNFPA, a decision tree in order to further guide data collectors through the various considerations, viable options they had, and alternative data resources, how to obtain information without jeopardizing women's safety or the data's integrity. And We have to say that this decision tree aims to identify data sources, including from administrative records, as Tatiana has already referred to, and methodologies that are useful for strengthening services and referral pathways for women experiencing violence against violence during COVID-19. Next slide, please. As I was saying before, violence against women pre-existed, of course, COVID. It's not COVID that created violence against women. It just exacerbated the risk factors. You can see here some of the risk factors that they have been exacerbated during COVID. We know that 740 million women work in the informal economy, and the income of these women fell by 60% during the first month of the pandemic. Early in the pandemic, less than 1 in 5 of labor market and social protection measures enacted to tackle the COVID-19 pandemic were gender sensitive. And of course, we can understand that leaves women unprotected and increasingly vulnerable, not only to experience violence, but also unable to live an abusive relationship. Next slide, please. So given all these circumstances, we had that, we have been experiencing, we had the exacerbated risk factors for sure, and we saw already that we had reporting of increased violence from different sources, especially from service providers and survivors themselves. Just for example, in Tunisia, calls to a helpline in the first days of the confinement increased 5-fold. In the UK, there was a 25% rise in phone calls to the National Domestic Abuse Helpline during the first week of lockdown, and visits to its website increased by 150%. However, although we have seen the increase of reporting to helplines and other service providers, we also had another very worrisome sign that we had in some cases, in some countries, decline in reports from survivors and women, suggesting that unfortunately some women were facing barriers to reporting violence or accessing help and services, and that services and help were not available to them, that it was a very worrisome sign to us. UN Women also conducted a rapid assessment to understand the impact of COVID-19 on violence against women and girls in service provision. The information was collected from different partners, and our own data showed in 49 countries in 5 regions, showed that an increase in reports and calls to the police in 50% of the countries. It also showed that several service providers had to divert their resources and efforts to provide immediate relief to beneficiaries. For example, many civil society organizations working on violence shifted attention to support livelihood needs of beneficiaries instead. And so you can imagine that many needs of violence survivors were unmet. Next slide, please. UN Women also worked to monitor how governments were responding to the COVID-19 pandemic. In September 2020, UN Women, together with WHO, launched the COVID-19 Global Gender Response Tracker that you can see here. The tracker monitors responses taken by governments worldwide to tackle the pandemic and highlights those that have integrated a gender lens. It captures 2 types of government responses. First, women's participation in COVID-19 task forces, and second, national policy measures taken by governments. It analyzes which of the policy measures address women's economic and social security, including, of course, unpaid care work, the labor market and violence, and lastly, the violence against women. And the tracker is used as a tool to provide guidance for policymakers and evidence for advocates to ensure a gender-sensitive COVID-19 policy response. Last time we updated the tracker, it was in March 2021, and we're planning to have the last update of the measures available this month already. Next slide, please. Just to give you an overview, with the March 2021 update, the tracker now covers 3,112 measures across 219 countries and territories. And you will see the majority of the all gender-sensitive measures, 64% of all these measures focus on preventing and or responding to violence against women and girls. This is indeed a hardening response to the UN Secretary General's call to action to have peace in the homes as well during the pandemic and the demands of women's movement around the world. And you can see the analysis there that the strategies and the responses of governments, they are focusing, as it is understandable, on strengthening services and much less, for example, on having longer term prevention strategies, which is very much necessary, as Tatiana was referring to in her presentation, if we really want to eliminate violence against women and girls one day. Next slide, please. As the situation was evolving and we were learning more and more about the different circumstances that COVID-19 was creating and how we could assess them and address them, UN Women has tried to address and overcome the challenges in the data collection on the direct impact on the pandemic of violence against women. And we tried to see how we could apply some innovative methods through some rapid gender assessment surveys on the impact of COVID-19 on violence against women. Data has been collected from women aged 18 plus in 13 low and middle income countries from Latin America, Eastern Europe, Arab states, Africa, and Asia. And we used computer-assisted telephone interviewing, using only mobile phone numbers to ensure respondents' intimacy. And we have some methodologies there, and of course, ethical and safety protocols were tailored to this kind of methodology. And all interviewers were extensively trained on this and how to handle incidents of survivors expressing some fear for their safety. I won't get into the details, but I consider that some of groundbreaking work in order to, first of all, assess the methodologies we're using in cases of crisis, and also to have a real data about the impact of COVID-19 on violence against women and girls. Next slide, please. The project that we're going to have some more information during the 16 days of activism against gender-based violence is aiming to increase the availability of reliable cross-country and nationally representative data of violence against women during COVID-19. First results of these assessments have been already informing the Generation Equality Forum, and you may remember that took place in Paris a few months ago. Final results, as I said, will be launched during the 16 days of activism campaign against gender-based violence. And we're going to provide certain recommendations to cover policy and programmatic gaps. findings are already available from Cameroon, Kenya, Thailand, and Ukraine. And the emerging data confirms the pandemic of violence against women. Between 21% to 55% of women reported feeling less safe while out at night since the start of COVID-19. Between 9 to 55% of women reported that the COVID-19 pandemic had made things worse in terms of their feelings of safety in their own household. Most women also report the perceived increase of intimate partner violence, with 38% to 92% of women who said they think the experience of verbal or physical abuse at the hands of partner has become more common for women since the start of the pandemic. And as I said in the beginning, also this research is an empirical exercise that is meant to enhance the evidence-based update of methodologies of our data collection and add to the guidance previously produced. Next slide, please. And most importantly, we really need to see how we use data and how we really move from data collection to action. And how do we form this action, the policy decisions and the responses to violence against women and girls? So the data that we had available during this period, it did inform the UN Secretary General's political engagement strategy, which was mainly a UN system-wide strategy to mobilize different stakeholders in order to prevent a response to violence against women. So that data was extremely useful. And the second aspect, how we used it, it was for the Generation Equality Forum and the Action Coalition on Gender-Based Violence, which is a platform of multi-stakeholders, an expression of multilateralism in order to address the complex phenomenon of gender-based violence. I will stop here, Adrienne, and I'm looking forward to the discussion later. Thank you very much.
Calliope, thank you very much for such interesting presentation and the comments. Of course, data, as always, data speaks by themselves. Very, very impressive and very important. And it's very important, I guess, to express and to stress this idea of before and after COVID-19. Because before, of course, we know that we have a structural problem related to violence against women, and suddenly COVID appears, and some people believe that suddenly the problem appears. That is not true, because someday we hope as soon as possible COVID will disappear and the problem, a structural problem, will continue there. So thank you very much for expressing this idea, and of course to share, because of sharing with us this data collection on violence against women and COVID, the decision tree, and the tools like the gender response tracker. Thank you very much, Calliope. Now, let's move to our next panelist. Our third panelist is Enrico Bisogno. Our very old friend in these topics is Enrico. Enrico leads the data development and dissemination section at the United Nations Office on Drugs and Crime in Vienna. He's responsible for developing and implementing the statistical program of his office, this office at UNODC, including activities related to relevant indicators for sustainable development goals. Among the recent activities from Enrico's office, he led the finalization of the International Classification of Crime for statistical purposes, the Manual on Corruption Surveys, and the Statistical Framework for the Measurement of Illicit Flows. Enrico has a lot of experience before UNODC, and even when he's working with the UNODC, he worked for the National Statistical Office in Italy, the ISTAT, for UNICE, the United Nations Economic Commission for Europe, and also for the United Nations Economic and Social Commission for Asia and the Pacific. Mr. Bisogno holds a PhD in demography from the University of Rome in Italy. Enrico, thank you very much for being here. Your presentation is entitled Violence Against Women During COVID-19, Evidence from Reported Data. The floor is yours, Enrico. Thank you very much.
Thanks to you, Adrian. Thanks for the long introduction, too long. My pleasure to be here with you and Tatiana and Calliope, of course. Okay, I will try, let's see if everything works. Yeah, can you see now my presentation?
Yeah, just put in, yeah, exactly. Thank you.
Can you see exactly what is it correct what you see? The slide? Can I go?
Enrico, we are seeing this presenter mode. If you can put in the show mode, please.
This
yeah,
way?
Exactly. Yeah.
Okay.
Thank you.
Okay, very good. So what I will try to describe to you in these few minutes is an initiative that we undertook. A few weeks, started a few weeks after the outbreak of the pandemic in 2020, April 2020. So we asked, we set up a rapid data collection on a number of topics. Crime, drugs, the ones that were our office, my office is focusing on, with of course also a specific focus on violence against women or gender-based violence. What we did was to ask member states, countries, national authorities to share with us a set of variables. You can see here the list in relation to violence against women and gender and domestic violence. A number of data on a monthly basis. The call was very successful. We got replies from more than 50, or depending on the period, 60 countries, and we are continuing also this. And in relation to violence against women, the data that I'm showing you now, we are showing, of course, a very small part or a small portion of those data, is based on submissions by 31 countries, from half of them from Europe, but also from the other regions, so from Asia, the Americas, Africa, and so on. So, and it covers, for this analysis, the period covered goes from October 2019 to August 2020, mostly. We should always keep in mind that these data refer to official, records from what comes to the attention of the authorities. So we should always keep in mind that the topics we are dealing with is, if you imagine an iceberg, we can only focus. We can only say something on the tip of the iceberg, what is above the surface. Of course, we'd like to reduce the size, to understand what is the actual change in the size of the iceberg. But we can always see only the tip. And we try to interpret what happens to the tip of the iceberg, where it goes, it increases or decreases, and then whether this reflects also a change in the overall size of the iceberg. This is always a challenging exercise. Let's go straight to the data. Let's start with this one. You can see here the recorded number of rapes and sexual assaults during the period from October 2019 to August 2020. And you can see here clearly, this is not the domestic, it's overall violence, so rapes and sexual assault. You can see clearly here that there was for the countries covered in this data collection, which are depending on the indicator 21 or 15, there was a drop in the number of reported in the reports of rapes of sexual assault, mostly in the period of the most the where there was a most stringent lockdown regimes in many countries across the world. This can be due, of course, to a number of reasons. For sure, what we can say, for sure, nothing is sure, but what we can imagine is that there was a decrease in the reporting by victims of these crimes. There was also a possible decrease in the number of incidents of these crimes, especially those outside the domestic sphere, because we should always remember that in the lockdown period, outdoor activities were extremely limited, and of course also the risk, the risk to be exposed to certain crimes was also accordingly reduced. What we can also see that as soon as the lockdown measures, the confinement measures were lifted, the levels went immediately back to the previous as in the previous situation. Now let's focus a bit if that was overall rape, forms of violence, sexual violence. Now the focus is on sexual violence and physical assault perpetrated only by intimate partners or family members. The period is from November 2019 to December 2020. Okay, besides, we should always take into account there is always a certain volatility in this type of data, in this type of events. But what we can see here in the correspondence of the period of the first lockdown, March, April, May of 2020, in these countries, there was again, also in this case, there was a slight decrease of reported cases. And what is also interesting, if you want to see, is that immediately after the confinement measures were lifted, there was a kind of a sudden increase. So it seems like that the reporting obstacles that were people, of course, mostly female, women, girls, were experiencing during the lockdown. Then immediately after these measures were lifted, there was a kind of effect of catching up of reporting of the situation of abuse or violence to authorities. So maybe the interpretation that there was a reduction in access to authorities, and then during the lockdown, and then after that, of course, a kind of catching up of what was happening immediately after, maybe find a confirmation in this, in these data. If the data that I shared with you so far refer to what are the complaints that are filed with the authorities, whether the police or prosecutor, we know very well that especially in those periods, in that period, there are other, victims of violence not only reported their experience to and maybe not necessarily, and maybe not all, for sure, to authorities, but there are other instruments, formal, informal. One very interesting source of information on this is helplines, usually telephone helplines that are active in many countries. I'm reporting here data only for 2 countries, which are kind of show 2 different patterns that we have seen in other countries as well. In Italy, we registered a very substantive increase, a very high increase of requests of assistance from victims of violence, domestic violence, during lockdown. Why this didn't happen in other countries, like, for example, as we see in Denmark. So always difficult to extract also different from different situations a general understanding. Also because we should always keep in mind that the confinement measures, lockdown regimes were very different in different countries. So, and then of course this can have an impact on in this case on domestic violence. Last data I want to share with you are about homicides by intimate partners. So what which is a form of what we often refer to as femicides. In this chart, you can see both victims of homicide, both by intimate partners, both female victims and male victims. It's a selection. We should always keep in mind that it's a selection of countries. In this case, it's 13 countries. But what we can see here again, there is in this case a sudden decrease, but for female victims in April. But again, these are always very difficult data to interpret because they're extremely volatile data when we consider monthly series. In any case, what we see that if there was a small drop in 1 month, then immediately after, unfortunately, the trend continued. So the number of female victims of their intimate partners more continued, irrespective of the situation. So what can we say about, as I said, I'm sharing with you only a selection of data. You can find more in the brief that we published a little bit less than 1 year ago. And we will continue analyzing this data as they come and produce also another research brief. But what we can say based on the available information from different sources on domestic violence, overall, for sure, the impact varied across countries, across different types of violence. And in any case, when the change was detected, the situation went back to pre-pandemic level once measures were relaxed. Of course, a better analysis, a deeper analysis should consider that different regimes, lockdown regimes, were adopted in different countries, and of course, probably this had, of course, an impact on a different impact on domestic violence. And the other thing that also different sources can tell different stories. So it's important to understand that the information, the sources of this information, so that we can really interpret them in an accurate manner. Access to formal and informal support networks, characteristic of victims and perpetrators, of course, have a role to play in understanding these sources. But putting together all the information, we can say that there is not yet a consistent evidence on the type of impact of COVID and especially of the confined measures due to COVID on gender-based violence, and specifically for violence perpetrated in the domestic sphere. For sure, what we can say is that even under these exceptional circumstances, gender-based violence and specifically domestic violence continued. And after a sort, maybe even if there was an impact, that in any case, immediately after lockdown finished, the violence continued. So it's maybe now that we can take a little bit a step back from what happened over the last year and a half. It's important that we continue to see the dynamics of domestic violence and abuse as not certainly as an emergency, not as an effect of COVID-19, as also already my previous speakers said, but as a product of gender, social, and cultural norms and certain specific abusive factors. So, and this is my last slide, is important from our perspective of data producers, data providers, if they improve the understanding and monitoring of what's happening. both in the short term and in the long term. Now, for a long time, there's been, rightly so, a focus on, for example, on understanding the prevalence of violence, the safety of women, the perception of safety. So, for example, now probably if we try to focus also in the information we collect and provide on other characteristics that are really useful, important to understand why certain violence is committed and when it's committed, by whom. So who are the perpetrators? What specifically triggers violence? And what works in reducing domestic violence? It's important that since that we know that unfortunately domestic violence and specifically gender-based domestic violence exists. We know that it has been existing for extremely forever, we can say, and what we now need to focus on is to understand what we can do to reduce it. So to understand specifically which are the women, which are the men, that what are the contexts where this takes place. For sure, timeliness is an important element of collecting information, and in this sense, the experience of a pandemic has also triggered some new processes also in the production of data, so that we can improve and be more relevant to the information needs from policymakers, but also general public at large. One thing that we hope we can contribute is in this sense is the new statistical framework on gender-related killings that we are developing together with the UN Women, which will provide a unifying, a common framework to define gender-based killing, to understand what are the data that are key to collect, and to standardize, harmonize them as much as possible across countries. One last point is that for sure, one thing that the pandemic made clear that the accessibility to services for victims of violence was a weak point, because as soon as the pandemic, the situation, the lockdown regime were implemented, there was clearly an effect on the access of victims to reporting mechanisms. And this is something that a learning point that we should keep in mind, so that this chain, this communication is more effective and accessible as possible to victims. I will stop here. Thank you for your patience. If there's any question, thank you. Over to you.
Enrico, thank you very much. We don't have many patients, Enrico, but it was a great presentation, Enrico. Thank you very much. And I would like to stress two main ideas of many of your presentation. This continuous process of collecting and producing data that it is made in UADC is very important in order to have a comparability in the before COVID and after, during COVID and after COVID. This is very, very important. And also the comparability between regions, countries, and some situations, as you already said. And the other thing is that the other idea is that we have different sources of information, different data tell us, as you said, different stories. So, but this is very important to complement the data from different sources and different kind of data. Thank you very much, Enrico. And we have a very few minutes for some questions and answers section. I would like to from the speakers, from our three expert speakers, to have a very short comment on one or two topics. I would like to start the other way around, and I would like to ask to Enrico. Of course, we have a problem of under-reporting domestic violence, Enrico. How we can deal with it in the collection of data, and if you can make us a very short comment on what is the experience of what we learn during as a collectors of data collectors from this period of COVID, Enrico, related to violence and domestic violence, Enrico? Thank you. Your micro, Enrico.
Sorry.
Thank you.
For sure, there is we know, that there is a great problem of reporting. We know that this applies to many crimes, and more than in any cases for victims of sexual and especially domestic violence. For this reason, it's always important to complement, any kind of, for example, reported officially or reported data with, for example, survey data. That's a very important. This is something we still have to do, and for sure there is an issue of cost, timeliness, because we know that surveys are more expensive exercises. They take more time to be implemented, to produce data, and so on. But this is for the time being a direction that we can. Putting together sources from this different nature is something we definitely have to do. We are experiencing also the use of, for example, big data, so scraping the web to understand what happens in the web, to see again if that from that point of view also is an initial information. But again, one thing that we should also always keep in mind that different data can provide answers to different questions, and also reported data on reported crime can always be useful for example, for assessing trends, for assessing certain characteristics of the victims, for assessing certain characteristics also of the perpetrator. So, we should always try to get the best out of the data we have. And so even if the reporting crime issue is there, and we have to live with it for probably forever. So we have to try to extract the best possible the information from all the sources that we have. You also asked me what we learned from this exercise that we can. I think one of the good things is that this situation forced us to be, us in general, a producer and a provider of data, to think about a little bit outside the box and create a new data, new ways to collect and again produce information. It's really important to put together a lot of data, a lot of information. And even if sometimes the information is not perfectly in line with our objectives, we have to be ready to accept the data as they are. And again, because this is I think the role really of evidence-based policy making. Thank you so much.
Thank you, Enrico. Calliope, the tools that you show to us, like gender response tracker and the data collection of violence against women during COVID are very important. Can you tell us how you use this information that you collect in this period in order to advocate policy action for different stakeholders? I mean, not just the governments, maybe some NGOs or many other actors that are always around the gender issues. Please, yes. Calliope, can you?
Thank you very much. And if I can complement to what Enrico had just said, one key message of our advocacy and policy recommendations to governments and others, it was first of all that services for violence against women survivors, they need to remain as essential ones, and that meaning that they need to be a part of the package for COVID-19 responses of governments while addressing COVID. This is one. And that's why we had in some cases anti-reporting of violence, because in most cases, women, they didn't even know that these services were even available. So keeping them open, keeping them available and providing information to survivors, it's very, very important. This is one key message that we had for governments and others. A second key message that we had, it was that many service providers, they are comprised of women's organizations. And we know that they had long-standing challenges with underfunding and also major challenges for their function. So the second key message was that we need some flexible and core funding for these organizations in order to be able to continue providing services to survivors. And one key, the third key message was that while we do all this work in order to address the acute needs that COVID-19 created and exacerbated the risk factors for violence against women and girls, ongoing already work before COVID-19 shouldn't stop. So we did advocate for continuation of legal and policy reforms that they were in the making before COVID-19, and also investing on longer-term prevention strategies in order to address the root causes and structural causes of violence against women and girls. Thank you.
Thank you, Calliope. Very, very interesting. And Tatiana, historically, OECD has been recognized as an international organization who always looks for have impacts on policy making. This is a very historically role of OECD. And related to gender-based violence, how OECD is looking for have impact in the decision making in governments, and with this case on even with the COVID-19 responses, and specifically also OECD is always a very innovative organization. So how you see it within OECD that technology and social media can help OECD and governments to identify cases of gender-based violence? Tatiana, please.
Thank you, Adrian. And of course, yes, this is really a vast topic of how to achieve impact of different policy measures. And as I was already mentioning during my presentation, that it is quite crucial that governments invest also from the outset in developing robust evaluation frameworks to understand what is working and what is not working, what type of intervention is actually generating greater impact, be that reduced rates of revictimization or reduced rates of reoffending. So is it at what stage of the violent cycle these interventions should be taking place? So this is a really complex discussion, but certainly when it comes to technology and social media and really trying to understand the big picture, because as Enrico was saying that we really need to look at complementary sources of data to understand the full picture. That different data sources tell a different story. So it's really about combining data sources. And here, for instance, we know that online surveys, so using technology for surveys, can help reduce, let's say, the risk of getting out for women and reporting violence. So they can use technology to do that. It can also help protect privacy in some cases, but of course we need to be mindful that the perpetrators are often in the same household. So it's actually creating safe conditions. Big data, it's actually an important topic also now for the OECD to really look at how we can be exploring the use of big data to try to understand different trends. For instance, the analysis of the Google mobility database showed that there were actually more reports of GBV in the areas which had tighter restrictions on mobility. So by combining different sources, so reporting of GBV, but also looking at, data sources such as Google Mobility or anything else related to big data can help us uncover different patterns of this phenomena. And of course, yes, social media, we know that social media can perpetuate GBV, but it can also be an important source of help. We know that during the pandemic, there were many efforts to post different support messages on social media for GBV survivors, also providing services. And there were a lot of innovations, I would say, like vanishing messages that you publish a message crying for help and then it disappears, but those who need to access it, they see the cry for help. So those are maybe the important elements that we need to continue exploring in really getting a comprehensive picture, but also most importantly, a comprehensive response to this phenomenon.
Thank you, Tatiana. Well, we are over the time, and we are going to close this our session. First of all, I would like to say thanks to our panelists, Tatiana Teplova, Calliope Mingueru, and Ernesto Bisoño. I mean, Enrico Bisoño, of course. Thank you, all of you. Your experience and your concepts are very, very important to analyze and to understand what is happening in the topics of violence against women, gender-based violence, and domestic violence, mainly at this time. Thanks also to all the people in the audience, both in Bern and also in the HUA platform, for your time, your patience, and for attending this panel. I would like to stress an apologies for the beginning of the technical issues, but you got the most important, the presentation of our three speakers and this final part of a Q&A section in the interchange. As you see, the three organizations, the OECD, UN Women, and UNODC, are working together because this is a very complex and structural problem and issues, and we need as much help as possible. So we hope you enjoyed this session and you enjoyed the rest of the UN World Data Forum. Thank you and have a good time. See you next time. Thank you very much. Take care. Thank you very much to all of you.
Thank you.
Thank you. Thank you, Enrico. Thank you,
so
Tatiana.
much.
And thank you, Calliope.
Bye. Bye-bye.
Thank you. Thank you.
Bye-bye, everyone.
It was
Thank
great.
you.
Thank you.
Thank you,
Bye.
Calliope. Nice to meet you. Thank you, Tatiana. See you next week. Also, Enrico,
Absolutely.
I guess. Thank you. Thank you. Thank you very much.